Good afternoon, everyone. My name is Bernard Rubenstein, Managing Director of Franchise Benefit Solutions. I want to thank everyone for joining. This webinar is being recorded. We will be sending out one of the two recordings to all grocery outlet operators that have registered and attended between yesterday and today. Over the next 30 minutes, we're going to cover facts about franchise benefit solutions, overview of grocery outlet enrollment, challenges facing operators today, our program advantages, 2024 product portfolio, solutions to help you hire and retain employees, key provisions of the Affordable Care Act, 2024 open enrollment, and at the end, any questions or comments. With over 40 years of experience specializing in customized benefit programs, our firm provides exclusive national and local plan designs to businesses across the United States. Over the years, we've had the privilege of partnering with Valpak, The Joint Chiropractic, Comfort Care Home Care, Authority Brands, 5-Star Franchising, The Casual Pint, and Jenny Craig, amongst others. In recent years, many operators have expressed an interest in offering alternative benefit plans to help recruit and retain employees. Since 2010, we've enrolled 202 grocery outlet operators in one of our benefit programs. Why do operators choose us over a local provider? We know what it means to be an operator. We've been working with grocery outlet operators since 2010. We're experts in benefit solutions. We offer an exclusive grocery outlet operators program. We're knowledgeable of the Affordable Care Act and how it may affect you. We offer outstanding service, and most of all, operators trust us. What are some of the biggest challenges facing operators today? Over the past several years, we have found that operators have challenges with hiring and retaining employees. We probably get calls on this every day or every other day. Offering affordable health plan options, new operators with limited benefits knowledge, and ACA compliance issues for operators with a second store that may have over 50 full-time employees. So why should you offer benefits to your employees? Employees are the heart of any great business, and key employees and leaders are essential to long-term success. Once you get a great team in place and they're performing well, it's a huge blow to lose any of your indispensable employees. Benefits are no longer a perk in today's business world. They're an expected part of compensation. Here are a few good reasons to offer benefits to your employees. First, attract and retain your best employees. By offering quality benefits, you will attract and retain qualified candidates for your business and keep your best employees happy. Second, increase your bottom line. By offering benefits instead of higher wages, you win by having a lower wage-based match for state and federal unemployment taxes. Boost morale. By offering a benefits package, you show an invested interest in your employees. In short, benefits can help promote good morale by keeping employees happier and healthier with less turnover for your business. Promote employee health and wellness. When employees have access to wellness, preventative care, doctor visits, and telemedicine programs, your overall business environment is healthier. Fewer employees are out on sick days and fewer people coming into work ill. Beat the competition in the race for talent. By offering an ACA-compliant health plan and voluntary benefits, you can beat out half your competitors that do not offer benefits. And finally, create loyalty. Health insurance is an emotional offering. It says to your employees, you are a valued asset to this company, and we care about your well-being. You're probably thinking, why franchise benefit solutions? What's the advantage of your program over other programs? Or what if I looked at a similar plan on my own? First, we offer exclusive grocery outlet plans and rates, all with guaranteed acceptance and no wait-in periods. Our plans and rates are the same no matter where your store is located. If you have a store in Washington, California, Oregon, Nevada, or Pennsylvania, the plans and rates are the same. We don't require employer participation or contribution. Plans can be employer paid, standalone, voluntary, packaged together through payroll deduction. You choose the benefit you want to offer your employees, and your employees enroll online through our online portal. Our portfolio of products include medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, and prescription drugs. Again, plans can be employer paid, standalone, packaged, voluntary, or packaged together through convenient payroll deduction. Our benefits platform includes 3 medical options: individual family, comprehensive group, and voluntary group. You may be thinking, what's the difference between comprehensive or voluntary? The choice between comprehensive and voluntary plans is not one size fits all. Some may prefer the extensive coverage of comprehensive plans, while others prefer voluntary plans that address specific healthcare needs. Comprehensive medical plans, such as, if you're in California, it may be Kaiser, Blue Shield, or Anthem, United Healthcare. While, let's say you're in Oregon, it's probably one of our plans with United Healthcare. Our comprehensive plan will include wellness exam, doctor visits, lab and x-ray, urgent care, emergency room, hospital stays, prescription drugs, preventative care, and specialty services. So you can see it's a complete package of services. While the voluntary plan offers a limited scope of coverage and is typically focused on specific types of care, such as wellness exams, doctor visits, urgent care, lab and x-ray, and prescription drugs. Generally, our program also, you can choose accident and critical illness to add to the package. Cost-wise, comprehensive plans are generally higher monthly premiums and lower out-of-pocket cost when you need medical care. Voluntary plans are going to be much lower premium, but the employee will pay higher share of out-of-pocket expenses. Mandatory or optional plans. Generally, we see that the comprehensive plans, they may be mandatory depending on if it's mandated by law. If it's part of the employer large group, you have more than 50 employees, then yes, it is. Comprehensive is mandated by law as long as you offer benefits. It may also be where a guideline from the insurance carrier requires 50% contribution from the employer for the employee cost, whereas the voluntary medical, the employer does not have to contribute at all. So there are differences between the 2 types of programs. Comprehensive also offers HMO, EPO, point of service, and PPO plans. So you have a different choice of plans. One other plan I forgot to mention is health savings accounts. In case you have a health savings accounts, the 2024 maximum, I think is right now is around 3,800, and it's going up to 4,100 maximum for an individual. For those operators that don't want to offer a group plan for their employees, but are looking for an individual medical plan for themselves or their family, we offer an online quoting portal they can view at their own convenience. Once you input your information, you can compare affordable medical plans from different carriers, find out if you qualify for financial help, view benefits at a glance, view local providers, and apply online or download enrollment forms. If you're considering your group plan options, we can help you make the right decision that best meets the medical care needs of you, your business, and your employees. Group plans are based on the demographics of your business, along with your employee and dependent ages. We would need census information in order to provide you with a group plan proposal. Our third and most popular option is our low-cost voluntary group medical plans, similar to an association health plan. The plans are the perfect strategy for operators focused on cost containment, usable daily benefits, and compliance with ACA mandates. The WellCare plan covers preventative services only. The Prime Care plan, which is new for 2024, is similar to the WellCare plan. However, this plan includes primary care office visits and prescription drugs. The Elite Care plan covers preventative services, primary care and specialist visits, along with urgent care, lab and x-ray services, and generic prescription drugs. So again, on the screen, the WellCare plan covers physicals only, which could be the exam, any type of testing, blood tests, mammography, colonoscopy, immunizations, again, any type of service that's under a routine preventative service is covered 100%. The primary care, which is new for 24, is similar to the WellCare. However, primary care office copay is included, as well as preventative generic drugs. The Elite Care is formerly the MEC Plus plan. This plan here includes 100% routine preventative care, copays for primary care office visits, specialist visits, urgent care, lab and x-ray, and preventative generic drugs. So there are copays for each of those services. This plan does not cover inpatient, outpatient, or emergency service, but we do offer a hospital confinement plan that could be packaged with the Elite Care. The IHP Basic and IHP Premier are two plans that are more of a comprehensive type program. As you can see, it does include the primary care office, specialist, urgent care, lab and x-ray, diagnostic testing, inpatient, outpatient, emergency room, ambulance, urgent care, additional service, home health care, hospice, chemotherapy, rehab, chemical abuse dependency, and then prescription drugs. You'll notice that there are asterisks after some of the hospital and facility services. The reason for that is, if you notice at the bottom, benefits are subject to reference-based pricing, which means as long as your hospital or facility accepts Medicare, then they will accept the plan. The plan will pay up to 200% of what Medicare would pay. So again, we've had this plan for, we're on our second year now. We've had no issues with it. So if you're looking for a comprehensive plan, cost most likely would be less than what it would be for comprehensive care carriers. So you may want to take a look what the cost would be again on this. We would need census information to obtain quotes for the IHP Basic and the IHP Premier. In addition to the medical, we offer voluntary group dental, three PPO plans through MetLife, and one California-based DHMO through Delta Dental. The MetLife plans, the first two plans are similar. Benefit maximums up to $1,000. The preventive services are covered at 100%, basic covered at 80%, major services covered at 50%. Plan 3, the orthodontia is not covered, while Plan 4 covered at 50% up to $1,000 lifetime. Plan 5 is similar to Plan 4, other than the benefit maximum is $2,000 instead of $1,000. For those of you that are looking for a low-cost DHMO plan, we offer a plan through Delta Dental and Delta Care. Does not have any type of deductible or benefit maximums. You simply pay copays, office copay, $5 copay, restorative services $50, crowns $185. As you can see, the simple copays for benefit services. I think there's about 30-something pages of services or codes that include different copays. So if you're interested in the low-cost Delta Care dental plan, please let us know. Voluntary group vision. We offer 2 plans through VSP, which is administered by MetLife. The 2 plans are similar. Plan 1224 and 1212 has a $10 copay for eye exam once every 12 months. Glasses, plan 1224 is a $25 copay once every 2 years, while plan 1212 is once every 12 months with a $25 copay. That would include lens frames or contacts. So again, lens frames or contacts is a $25 copay once every 12 months for the 1224, and the 1212 is once every 12 months. Frame allowance, 1224 is up to 130, while the plan 1212 is up to 150. You can also visit retail chain providers such as Costco, VisionWorks, and Sam's Club. Our life insurance program, also through MetLife, we offer 2 options. The first is group life through, which is employer paid. Benefit is $10,000 for the employee plus AD&D. Second option is voluntary life, which is employee paid, not employer. Employee can select up to $150,000 or 5 times their annual pay. They can also select up to $50,000 or 50% of the employee amount for the spouse, and dependent children up to $10,000. Evidence of insurability is not required when first eligible. Being that this is going into our 2nd year with MetLife on the life insurance. If one of your employees did not enroll in the life plan last year, but is wanting to enroll for 2024, they will need to answer health questions. So if they're looking for life insurance without any type of health questions, then they're going to want to enroll when they're first eligible. So for 2024, we're going to be offering a new virtual primary care and telemedicine plan. The virtual primary care is a plan similar to as if you're going in to visit your own primary care physician at his office. Instead of visiting office, this is a virtual primary care. So you have your own dedicated physician, you name your own physician, primary care. Primary care services include the wellness exam, health risk assessment review, screen lab review and recommendations, follow-up visits, care plan development, ongoing support, chronic condition management, post-lab ordering review. And again, so just like going to visit your doctor, if you have a question for the doctor, you reach out to your own primary care. You don't have to worry about getting another doctor, and then the doctor will speak to you. Also includes at-home labs, where you will receive a lab kit in the mail. You collect your blood sample and mail them to the lab in the prepaid package, and then your primary care doctor will reach back out to you and review your blood test. Your dedicated primary care can also order electronic prescription drugs. Prescription drug plan is also included in here for a zero copay. It is generally for generic drugs, but it does include 70 generic prescriptions at no cost to you. In addition to the services I just mentioned, it also includes psychiatric care, behavior health, which includes topics such as anxiety, grief, depression, marital issues, and stress. This is one of the questions that we've been ongoing since COVID. So for 2024, we looked at this type of program and decided to add the virtual primary care. Telemedicine, similar to the Teledoc program that you currently may be on, but for 2024, we're moving it to Recuro Health. There is no cost, there is no copay or consultation fee. This one is for family coverage. I think the cost for the telemedicine is $11 a month, while the virtual primary care is $48 a month. Both are for family. So it doesn't matter how many are in the family, it's a flat rate. So the virtual primary care is $48 for the family, while the telemedicine is $11 for the family. Now, the telemedicine is a program where, let's say you're at the store, you hurt yourself, but you want to talk to the doctor. You call the doctor, give them your symptoms, they'll give you a diagnosis, and they'll even call in a prescription. Again, our new telemedicine program will include behavioral health and psychiatric management. Voluntary hospital confinement program. This is the program that I mentioned that under the voluntary medical, you can add the voluntary hospital to the voluntary medical as a package. You have the choice of 2 benefit options. Benefits cover both injuries and sickness. Benefits are paid for inpatient, outpatient treatment received in the hospital, emergency room, and the doctor's office. Additional benefits include surgery, anesthesia, diagnostic exams, pregnancy, lodging. As you can see, this is only a minimal scope of what the benefits cover. But again, if you're going to add the voluntary medical, I would suggest packaging the voluntary hospital to the medical plan. Our voluntary accident plan covers accidental injuries regardless of any other insurance. Benefits cover both inpatient and outpatient treatment, covers more than 50 benefits, includes hospital admission, hospital confinement, ambulance, emergency room treatment. Now, again, these are just some of the benefits of services that are if you had an accident or an injury and you were in the inpatient or outpatient. It also includes a lump sum payment. If you happen to, let's say, fracture your hip, it'll pay up to a $5,000 benefit. And it also includes a dislocation lump sum payment. So let's say you dislocated your kneecap, it'll pay up to $2,500 lump sum. Our most popular plans to help you hire and retain employees. And again, this is probably the biggest question that we get from operators today. We've got 4 packages on the screen. The package 1, the operator offers a dual voluntary medical plan and contributes towards the employee only cost. The employee contributes balance of the employee cost plus dependent cost and any buyout plan. Operator offers voluntary benefits at 100% employee pay. So again, if you decide that you want to contribute, which you don't have to, then you can contribute to the voluntary medical. And then the employee would also contribute the balance plus any dependent or buyout. And then when it comes to the dental, vision, and additional benefits, I don't think we have an operator that contributes towards those benefits. So I would offer all those benefits as 100% employee pay. Now I'm going to jump to package 4 because package 4 we find is probably right behind package 1, or it is probably number 1 right now. Whereas the operator offers voluntary benefits to all employees at 100% employee pay. So the operator does not contribute at all for the voluntary medical, dental, vision, and pretty much the whole program. Package 2, which is listed here, operator enrolls in a management-only group medical plan through the special enrollment period, which I'll get into in a minute. Operator contributes 100% for themselves, management employee 50%, and then offers the voluntary benefits to non-management employees at 100% employee pay. And again, that includes the voluntary medical and the additional voluntary benefits. Package 3, which we really don't find many operators selecting because average employees per store is around 25 to 35. The insurance carrier is going to require the employee to contribute 50% of the employee only, and that's going to be pretty much too cumbersome for the operator to contribute. So under this program, the operator enrolls in a comprehensive group medical plan. Operator offers dual medical option. It contributes 50% of the employee cost of the lowest plan. Employee contributes the balance of the employee cost plus dependent cost and buy-up. And then the operator offers the voluntary benefits at 100% employee pay. Thought I'd also include a cost breakdown just to give you an example how we may set up a program. And again, we can help you set it up. You really decide how you want to set up the total program. Setting up the plan, let's say step one, operator sets up a class of employees based on job title. Class one could be the ownership, class two, store manager, class three, department manager employee, and class four, the front clerk employee. Step two, operator sets up a comprehensive group medical plan for ownership and store manager level employees. Operator contributes 100% for ownership and 50% for store manager employee. This may also be, we find that a lot of the operators have dependent children that are involved in their business. And this is a good way to set up if you can't afford to offer benefits to all your employees. You may want to set up the class using step one and two, and then step two, set up the comprehensive for yourself and let's say store manager or dependent child or children. Step three, operator sets up a voluntary medical plan for department manager employees and contributes 100% of the voluntary elite care plan. Step four, operator sets up a voluntary medical plan for front clerk employees at 100% employee pay. And then step five, operator offers additional voluntary benefits to all employees at 100% employee pay. I do want to mention that we do find that a lot of operators, some operators will have their dependent child or son or daughter as a dependent manager, but they want to include them as a department manager, but they want to include them as their for the comprehensive plan. If this is the case, then you're probably going to want to set up a different class so that your dependent child is classified as a different type of department manager. And the reason for that is when it comes to setting up a class, whatever you do for one employee in that class, you have to do the same for all. So if you have one of your children listed as a department manager, but you don't have a store manager, you may want to change the class just so that you can include your dependent children. Monthly cost, and again, this is an example. The owner, age 55, decides to go with a United Healthcare plan, a PPO plan, with a $2,000 deductible, 80/20 coinsurance, $40 office copay, $50 urgent care copay, and $15 prescription drug card. Monthly cost, $885. Operator pays the whole premium for themselves. Store manager, let's say, is age 47, also enrolled in United Healthcare PPO plan. Instead of a $2,000 deductible, they will enroll in a $5,000 deductible, same coinsurance, same office copay, same urgent care and prescription drug card. The monthly cost for this individual is $657. The employer contributes 50% of the $657, so it's a split of the $328. Then the department manager, let's say age 35, set up under the voluntary medical elite care plan, which is the $15 office copay, $50 urgent care copay, and prescription drug card. Monthly cost is around $118. The employer will contribute 50% of that, which is $59. The employee would contribute to $59. And again, remember, This is the step 3. And then for the front clerk employee, which would maybe age 57, offers a voluntary medical, same elite care plan. 15 copay, 50 urgent care plus the prescription drug card. Monthly cost is still the $118, but the employer does not contribute at all. So the employee would contribute 100% of that. So again, we would help you set up, go over the options, suggestions, and then we'll put it in motion for you. So let's switch gears and talk about the key provisions of the Affordable Care Act. I will say this is probably one of the main issues that we run into with operators, that they do not know that there is a employer mandate. Most do know that there is not an individual mandate. The individual mandate no longer exists in most states. However, there are states such as California that there is a state mandate, and which is the state mandate is generally the same as the individual mandate. So California does have the state mandate, which requires all employees to have healthcare coverage or have a penalty of $695. The employer mandate does remain in place, at least for now. Congressional efforts to repeal and replace the ACA have stalled. I heard just yesterday that Congress may try to take up the employer mandate next year and not allow certain medical plans to be offered. Also, in California, Governor Newsom has set up a task force to examine universal care through the state. I know this has been going on for several years, but this is the first time I've heard that he set up a task force to examine universal health care. So let's take a look at key provisions of the ACA and how it will affect you. All full-time employees is an employee that works at least 30 hours. Benefit waiting periods must be 90 days or less. Employers with less than 50 full-time equivalent employees are not penalized for not providing health insurance. Employers with 50 or more full-time equivalent employees must provide health insurance or pay a penalty. So again, we get calls on when we start talking about setting up a program. We find operators will say, well, a full-time employee for us is 40 hours. And then we have to let them know that, however, under the Affordable Care Act, a full-time is 30 hours. Benefit waiting periods, we find operators have a 6-month wait for employees to for them to offer benefits. Again, under the ACA, it must be 90 days or less. And what we find in setting it up, we will set it up as first of the month following 60 days, which could lead up to 90 days. If you have less than 50 full-time employees, you do not have to offer health insurance and you will not be penalized. Now, if you have 2 stores or you're thinking of a second store and you will have more than 50 employees, then you are required to offer health insurance or you will pay a penalty. If we find that we've had calls from several operators that were thinking of offering or having a second store or applying for a second store, but once they find out of the reporting that they have to do, or they don't want to offer benefits, then they generally may have employees around in the 40s, but they don't want to go over the 50 full-time mark. Now, if you're thinking of adding a second store, we do have a colleague that all he does is works on the ACA, and he'll be able to help you set up or discuss what happens if you go over 50 and what's required. For the first year that you do go over the 50 full-time equivalent, generally we find that you don't have to file any of the reports, but after the first year, you will have to offer benefits. So again, if you're thinking of a second store, or you have a second store and you know you have over 50 full-time equivalents, now equivalent for general purposes would be all your full-time employees. Your part-time employees, we could calculate simply as 2 for 1. So 2 part-time employees could equal full-time. So let's say you have 70 employees and you have 35 full-time, 35 part-time. So you would have, let's say, 17 part-time equivalents, which would plus the 35. So you would be over the 50, you would be at 52. So then you would be required to offer health insurance. So again, if you're thinking of having a second store, or you do have a second store, and you don't offer benefits, please get a hold of us and we'll work with you on putting you on the right track. Looking ahead to 2024, there's a little known requirement under the ACA, which requires health insurance insurers to offer an annual 1-month special enrollment period from November 15th through December 15th to employers in the small group market who do not meet employee minimum participation or employer minimum contribution requirements. Many insurance brokers do not know about this requirement, and insurance carriers do not want you to know about this. Under normal underwriting, insurance carriers require at least 50% of eligible employees to enroll. Under the special enrollment period, 2 full-time employees must enroll. Just so you know, under the ACA, husband and wife are considered as 1 employee. So if you have 25 employees, under normal circumstances, normal underwriting, carriers are going to require at least 50%, or let's say 13 employees would have to enroll. Under the special enrollment period, all we need is 2 full-time employees. Could be the owner-operator and, let's say, store manager. Store manager could also be a dependent child, son, or daughter. We have many store operators, and I say we have quite a few operators that set up a program for their family by using this group special enrollment period. So if you're looking for a comprehensive plan, but don't want to offer it to all your employees, this is the time to enroll in a group plan from November 15th through December 15th. We will need your documentation probably around by the December 10th so that we can guarantee that you'll have your coverage approved by December 15th. If not approved by December 15th, then the carrier will not approve your group. So this is our accounting type seizing, if you will. If you're interested in that, please get a hold of us. Our benefits enrollment platform includes 4 steps from the initial contact through the employee enrollment process: identifying your objectives, reviewing your benefit options, providing easy to understand benefits communication, and optimizing the enrollment process through our integrated portal. So from the time that we begin our conversation with you, all the way through enrollment. Step 1, once we identify your objectives, determine your budget, and then we may gather some information depending on what you want to offer. If you're looking for a comprehensive, we'll need information, census information, and then we can obtain quotes, present the benefit options to you, and then suggest some or formulate a benefits plan. And then once you decide what program you want to go with and how to set it up, we'll put together a communication, easy to understand, easy to understand communication piece so that you can distribute to your employees. And then finally, step 4 is our online enrollment portal. Either at the time of orientation or the time that you're going to initially enroll in a program. Either you send the employee login to your employees, or we would do it if it's initial login. Once the employee receives a login request, they would create their password, go through the registration, verify their personal information, and add any dependent information. They would then begin their step-by-step enrollment process. For each benefit, they would choose their coverage level. They will need to enroll or waive one or the other. For each benefit, they choose their coverage level, continue until the enrollment is complete. Once it's complete, they would review their benefit summary and then e-sign their enrollment form. Their enrollment is not processed until they e-sign. So they get to the very end and they don't see where they would e-sign. That means they missed one of the coverage levels and will need to go back and complete. Just so you know that since the program is integrated, the enrollment portal is integrated with the carrier, the employee, we will not know that the employee completed their enrollment form. So if an employee comes back to you after and says, hey, we did complete it, and they find that they didn't get an e-sign, that means we will not know about it. So they must complete their enrollment, each coverage level, and then e-sign so that we know, carrier knows that they've enrolled in one of the benefit plans. So now we're at the end. If there's any questions, I don't see in there, but if you have any questions, please go ahead and add them to the Q&A. I've also got my contact information on the screen here. So if you want to get a hold of me, my email, phone number is provided. Again, I'll give it a minute here. If anyone has any questions or comments on here, I'll be happy to answer them. Again, we will be sending out a recorded copy of the webinar. We'll send out the employer guide and links to reach out to us. Okay, so I don't see any questions here. I want to thank you for attending the webinar. Again, any questions, please reach out. Have a great rest of your afternoon. Thank you.